Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. New legislation out to expand for veterans. Some very, very important information here. Now, I want to share this with you, and this is to increase veterans' access, and it's really specifically on the VHA side of the house for veterans. We're going to go ahead and jump into it here. This was just introduced, and the press release was back in July 17th, 2025, so just a few months ago. And I wanted to share it with you because if we're not talking about it and we're not letting our congressional members know that we support something, well, it might just sit there. So the more of us that say things, the more of us that reach out to our congressional members, the better. This one is actually called the No Pain for Veterans Act. No Pain for Veterans Act. Now, I got a couple different things pulled up. I got the official release on Congressman Derek Van Orden on his website, an official release there. Then I also have a DAV, Disabled American Veterans notification as well regarding this same piece of legislation. And so I am going to first rattle off the stuff from DAV. They have a great legislative platform, and then I'm going to go over to the press release from the congressman as well. So with that, hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. Every thumbs up, every minute watched really does help to spread the word, which is what we're trying to do, right? How many times have we sat around and had no clue what sort of things are going on that would impact us? Don't you think we should probably know? I do, because then we can either support it or say no, right? Yes or no's on things that we believe in. All right, so anyway, moving on, HR, which is House of Representatives, HR 4509, the No Pain for Veterans Act, would expand access to safe, non-opioid pain management options within the Department of Veterans Affairs VA healthcare system. This bill would require VA to include Food and Drug Administration approved non-opioid medications and biological products in its national formulary, ensuring veterans have access to effective and less addictive alternatives for treating pain. By mandating the inclusion of these therapies in the VA formulary, the bill seeks to improve the quality of pain care, reduce reliance on traditional opioid-based treatments, and provide veterans with the safest and most effective options available to manage acute and chronic pain. There's nothing wrong with any of that. That, I believe, is a good thing. You should reach out to your congressional member, let them know that you support it. Again, DAV has a fantastic legislative platform with easy, 1, 2, 3 click type stuff to sign up for your support. But you can also just call your congressional office. You can reach out to them via phone. You could stop by. You can send them a message through their website and let them know that you support this bill and you want them to as well. All right, so according to the VA Cooperative Studies Program, Epidemiology Analytics Resource Fact Sheet, in April of 2022 on opioid use, veterans face significantly higher risk of opioid use disorder due to increased prevalence of chronic pain, mental health conditions, and social stressors. These findings underscore the urgent need for a comprehensive nationwide pain management approach within the VA. DAV strongly supports HR 4509 in accordance with DAV Resolution Number 324, which calls for a consistent patient-centered pain management strategy that integrates safe and compassionate alternatives to opioids. By expanding access to non-addictive treatments, the bill seeks to reduce dependency, improve long-term pain outcomes, and enhance the quality of life for service-disabled veterans living with chronic pain. We urge DAV members and supporters to contact their local representative today and advocate for passage of HR 4509, the No Pain for Veterans Act. Thank you for supporting. Okay, so here's the thing. All of the service organizations out there do a pretty good job on the Hill for us, right? So they do a good job lobbying for us in DC. We need to take the ball into our own hands in the constituencies, right? In our own districts, we need to, pound the desk, so to speak, and get in front of our congressional members and let them know what's important to us as a veteran constituency. Now, if it's important to you as a veteran, it should be important to your spouse. If you have adult children, maybe they need to be making a phone call too. You see where I'm going, right? One phone call is cool, but what about 4 or 5 phone calls or emails or what have you? Then multiply that by many different households and so forth, and those numbers can grow. Moving over to the announcement on Van Orden's website here, let's read into this a little bit and see what else we can find out. Now, what we have here is the headline, which is Van Orden Landsman introduce bipartisan bill to increase veterans' access to non-opioid medications. Again, good. Today, Congressman, and this is back in the middle of July 2025, Congressman Derek Van Orden and Congressman Greg Landsman introduced bipartisan legislation to increase veterans' access to non-opioid pain medications. The opioid epidemic has impacted nearly every demographic in the United States. In response, Congress passed the Non-Opioids Prevent Addiction in the Nation No Pain Act in 2022. So seniors on Medicare have access to and never pay more for non-opioid pain management medications. To ensure veterans have the same access, Congressman Van Orden and Congressman Landsman have reintroduced the No Pain for Veterans Act. The legislation would reform the way the Department of Veterans Affairs handles veteran pain management by requiring VA to furnish and cover non-opioid pain management drugs under the VA pharmacy benefits if those drugs are covered by Medicare. Original co-sponsors of the legislation include Representative Sewell, I'm thinking, Bergman, Papas, and Hamadeh. All right, a quotation here. I thank the VA for taking the issue of opioid administration mismanagement seriously and the great strides they have made over the years to improve care for our veterans, said Rep. Van Orden. Veterans must have access to comprehensive medical treatment plans, and the No Pain for Veterans Act will provide pain management alternatives that are safer, more effective, and promote long-term recovery. Next quotation, our veterans deserve the very best care, which includes access to safer options for managing pain. Our bipartisan bill is a common sense step to make non-opioid treatments more affordable and available to those who served our country, and a way to prevent addiction before it starts. We can protect our veterans' health and keep pushing forward in the fight to end the opioid epidemic, said Representative Landsman. Another quotation, in 2022, Congress took a critical step in our fight against the opioid crisis by passing the No Pain Act, providing better access to non-opioid pain medication for seniors, said Rep. Sewell. The No Pain for Veterans Act builds our progress, ensuring that such treatments are available to our nation's veterans as well. By increasing access to non-opioid therapies, we can empower more Americans to effectively manage their pain without risking addiction, which is a good thing. Next one, our veterans deserve access to every effective treatment available without red tape or delay. The No Pain for Veterans Act ensures they get the care they've earned, especially when it comes to managing chronic pain with safe, proven, non-opioid alternatives. This is a critical step toward improving quality of life while reducing dependence on addictive medication, said Rep. Bergman. Last one here, or maybe the last, second to last one. Veterans served and sacrificed for our country, and they shouldn't face barriers to accessing the medications and treatments they need and prefer, said Representative Papas. Making non-opioid pain management more affordable and accessible to veterans is common sense for their health and for preventing addiction. This bipartisan legislation will close the gap on VA's non-opioid drug coverage to help our veterans stay safe and healthy. Last one here. I am proud to co-sponsor the No Pain for Veterans Act, and I am grateful to sponsor for the opportunity to support an effort to protect my fellow veterans with access to better health care options. Far too many of our veterans fall victim to the opioid epidemic due to lack of access to FDA-approved non-opioid alternatives. That is simply wrong. Our veterans deserve access to the full suite of non-addictive pain management options and so much more, said Representative Hamadeh. All right, with that concludes it. Again, this is the No Pain for Veterans Act. And you should reach out to your congressional member, let them know that you support it and you want them to support it. No Pain for Veterans Act. Thanks for watching. I appreciate you very much. Have a great one. And remember, if we don't take care of each other, something went wrong.